Hi, I'm Patrick Flaherty with bagmass.com, not only a place where you can find career advice, but your next anesthesia job. And one of the things that we're seeing in the market right now, we're talking about finding jobs, is people switching over to working locum tenens. And this raises a lot of questions that some people, don't know where to find the answers, and sometimes makes it them a little hesitant to make that jump. But we have two experts with us today. We have Lubov Abrams from Healthcare Contractors, and we have Vincent Dobransky from Mink Dobransky Wealth Management. It's going to sort of talk to us about, where you find health insurance and what you do with your taxes. And I think a natural place to start here is with Lubov. So I'm making this transition from W-2 to a 1099 position, where before I used to always had my options for healthcare insurance. My company would give it to me. Out of curiosity, why should I work for, or not work for, but work with a health insurance broker like yourself, as opposed to just searching for it on my own on the internet?
Yeah, that's a great question. It's actually something that comes up a lot. So when you are searching for things on the internet, first of all, you're going to get a lot of information. So you might be on an information overload. If you make the mistake of putting your number in to one of these like healthcare.com websites, you're going to get like 300 calls. So get ready for that. Lots of calls from agents. So you're going to feel overwhelmed, just that part of it. And so that's kind of the experience. But in terms of what, the natural transition, working with me, I'm kind of holding your hand, really educating you on all your options, and just to try to make sure that I'm giving you the right plan. And because of my years of experience, I can kind of listen to your story and figure out what that plan is for you. So I try to make it easy, and you don't have to get 300 calls when you put your name and number into a website.
Yeah, I mean, as a healthcare provider, we're getting calls all the time already from recruiters, and it gets to be a little annoying, and emails all over the place. And I know you're already working with some anesthesia providers out there. What are some of the common questions they have for you when they first talk to you?
Yeah, I mean, I think there's just a lot of fear surrounding losing their benefits. So they just want to know first and foremost, what options they have. And so we quickly go over all of their options based on their health. They may qualify for a private plan. Maybe their health isn't where they need, where they want it to be. And so then we look at marketplace options. We discuss COBRA. So first and foremost, they just want to know that they have some sort of plan to continue their benefits, even if they're not the same benefits they had before, but just something that, they're not going to be without benefits. Also, I get a lot of questions about HSA accounts and FSA accounts, and understanding which plans work with either accounts. So we spend a lot of time educating clients on that as well. And then inevitably taxes come up with health insurance, and there's some tax benefits to going the private route. So we talk about that as well. Just again, kind of holding their hand, listening to their story, acting like the doctor. Let's get the symptoms before we get the diagnosis, and the diagnosis is going to be what plan we're going to put you on.
Gotcha. And before we get to the tax benefits, we're going to talk to Vince about that in a little bit. Is back to the money portion. Is do they have to pay for your service? Is this a free service? How does that work?
They do not have to pay for my service. So I get paid directly from the insurance carriers. So I'll get a commission, usually of the premium. Sometimes it's a flat amount, but it's nothing that the customer has to give me. So I have no, it doesn't matter to me what plan I sell you, because I'm going to get paid either way. And sometimes I'm not able to offer you a plan, and you just get free advice, and that's okay too. Yeah, but there's no cost for my consultation.
Gotcha. Sometimes we get free advice in anesthesia also, and we don't get paid for it, but
Right.
it's great. We love helping people. That's why we got into this. Vincent, transitioning over to you, we've all mentioned tax advantages to buying your own health insurance. But before we get there, I'm curious about what questions should a person be asking, CPA or someone that's going to be dealing with their taxes, to make sure that they're a good fit. Because I've been in the position before where somebody gave me a recommendation, or not even a recommendation. They said, there's somebody over here at this booth at this conference, the CPA, they're doing taxes. And I said, sure, they're here, they must know what they're doing. I signed up, and I just got royally screwed, let's put it nicely, on my taxes. So what questions do you suggest someone should ask you, just so they can figure out you are a good fit, or, along those lines?
Very much along the lines of what we both said. Sitting down with people is free. You know, people always have questions, especially if they go from a W-2 to a 1099. What can I write off? What can I deduct? What's my retirement look like? I have to buy health insurance. Am I able to use that as a deduction? The biggest thing is really just having a conversation. I've always sat down with people for 15, 20 years when I've been doing it on my own. We just have a conversation. We just have a chat. People need information. The internet is filled with stuff. The tax code is black and white. The IRS is not very willing to sit down and talk to you, but everybody needs help in some capacity. For those that go to the 1099 world and become their own either self-employed person or their own entity, I like to use the phrase that you become like a General Electric or Microsoft with all the bells and whistles and privileges. But for that, there's a certain process that has to be done, not only categorizing all of your expenses, but also utilizing your time and knowing exactly what you can and cannot do when it comes to filing a tax return or claiming things before you go to file.
Gotcha. And out of curiosity, I know with the W-2, it's, it gets filed once a year. When you're 1099, is that filed the same way? Is it quarterly? Is it monthly? Is there?
So if you file a 1099, you file on tax day. If you happen to create an entity like an S Corp, those are always due a month earlier. But with being self-employed in general terms, you potentially would have to pay quarterly taxes and have different times throughout the year with money is due or different I guess expenses should be reviewed. A lot of my self-employed folks, those that have corporations, we meet always in the spring when we get their taxes filed, but also the remaining 2 or 3 calendar quarters of the year, just to ensure that they have everything. Some folks have really good quarters depending on the type of industry that they're in, where they make a little bit of overtime. So we have to recalculate estimated taxes and make sure those are filed on time. The first usually 6 months to a year that somebody goes into that 1099 self-employed realm, there are a lot of nerves around it. So the biggest part is getting folks through that first calendar year. Once they become comfortable, it's almost like on autopilot, and they realize how much they can maximize from an earning standpoint, their own earning potential, and then the sky's the limit from there.
That's great. Guys, I really appreciate this. I just want to sort of keep it quick and short. I think it's great information. For everybody out there watching this, we will make sure to have their contact information not only at in the description, but at the end of this video. Please feel free to reach out and talk to them. I've done it before. They're great. It's great to sit down and talk to, wealth of knowledge, and they're going to get you guys on the right path. So I really appreciate it. You guys have a great day.
Thank you very much.